Antonio. We are here at the Fascial Research Congress in New Orleans, and luckily Antonio is over here presenting from Italy, so we've got the opportunity to chat with him for a little bit. How are you?
I'm pretty good. I mean, very excited to be here and to present the new research about fascia and fascial manipulation.
What are the studies that you're presenting? What are the research?
So we are presenting about the biomechanics of fascia, so how fascia can be modified even with manual therapy. So, everybody see this in clinical practice, but nobody ever will demonstrate with bioengineering study or imaging study.
Excellent. And what have you found?
So we found that with a particular imaging, a particular MRI, you can understand that you can change the viscosity, the quality of the extracellular matrix. So it was like first study that proved that the manual therapy can really change the extracellular matrix, that is the major component of the different layer of the fascia.
And that's exactly the technique that we're teaching in the fascial manipulation classes, right?
Right. That was the study was a control group, and study group, and basically we have done fascial manipulation 3 sessions, and we have a test before and after the treatment, what exactly happened at that level, in particular in the elbow region.
Ah, very good, very good. One thing we wanted to ask you about was to just we talked a little bit yesterday about how the fascial manipulation method is not just a manual therapy technique, it's really a thought process. Can you maybe expand on that?
Yeah, I mean, fascial manipulation is a method, so it tells you how to assess, how to make diagnosis, and of course how to treat. So people appreciate worldwide that we give a way to understand what is myofascial problem and how to set up a treatment plan. Then if you use the knuckle, the elbow, the shock wave, the needle, it doesn't really change. You have to make sure that the points are released, what we call densification is resolved. And the combination of points matter, because at the end of the day, we don't spend so much time over there with the symptom, because maybe that is the manifestation of the problem. Maybe the biomechanical problem due to a lack of gliding can be generated opposite or the other side of the body, because we have to understand before the biomechanical model of the human fascial system. And from there, we understand the symptom. Because as we always say, it's not enough to take off the pain. We have to restore the biomechanics. Only in that way you can give a long-lasting result.
Yeah, very true, and we definitely see that clinically. And can you just kind of quickly describe the different levels? So we have different levels for classes, so FM1, 2, 3, and 4. Can you just briefly describe what we learn in each of those classes and how they sort of build on each other?
Yeah, level one in hybrid versus 3-day, you're going to learn the center of coordination, the center that works for the more movement in the major plane, so like frontal, sagittal, horizontal plane. So this helps you to treat any pain that are related to motion. So if I move, I have that pain, that will be strongly related with the center of coordination. Level 2 will be more related with the center of fusion, so where multiple vectors converge. So for complex motion or for no motion, because the nerve, they go through that area where loading is not so evident. That is why the patient comes into your office and look, my shoulder hurts during the night. But then I play tennis, I can play, but then when I'm driving back, it hurts again. That is a typical condition where the central fusion are related to this problem, and you can improve complex gesture, equilibrium, strength. So this is like at the core of level 2. Of course, level 3 will introduce the inner fascia, because the myofascial pain is not just musculoskeletal, it's visceral. So we will try to understand the anatomy of that. We try to understand what does it mean, like the bloating, how you address bloating, reflux, incontinence, dysmenorrhea, dysphagia, dysphonia, all this kind of dysfunction that they don't have a pathology behind. So the investigation are negative, but the patient have maybe a miserable life due to this problem. So don't believe that myofascial pain is a minor symptom. It can be a major, really can affect dramatic quality of life. And through this additional anatomy, you understand that we don't work just proximal distal, but we work in 3 dimensions. So it's we call it a global approach, because you never know if the knee pain is a musculoskeletal region or is a visual somatic region. People that have a bladder infection for years will generate compensation, will hit the knee. So this knee will hurt even at rest, and nobody's able to figure out what is wrong. It's a visual somatic problem. So level 3 is not just for treat the visual problem. And so, I mean, musculoskeletal physiotherapy is not for me. Level 3 is for treating the global patient. So you can address also symptoms like a heel pain, bilateral elbow pain, that are not a musculoskeletal region, but visual one. It has to be fully understood. It's more common what it look like.
Excellent. And then is there a level 4?
Of course, level 4 is about superficial fascia. So, you know, everybody know about lymphedema, everybody know about the painful cellulitis, everybody know about eczema, you know, paresthesia, dysesthesia. So superficial fascia is strongly related to lymphatic system, is strongly related to the infrastructure, the lobular fat, is strongly related to all the superficial nerve. So when superficial fascia is altered, on top of all the other, you know, problems you can have with the visceral fascia, musculoskeletal fascia, deep fascia, you can have also that one. And of course, we can give an example of fibromyalgia. Fibromyalgia for sure is a level 4 patient, no doubt about that. Complex regional pain syndrome, for sure there is a multiple nerve entrapment that will generate a disorganization of the autonomic system. So level 4 it gives you a, you know, a way, a key, you know, a flow chart to, you know, understand what the patient, how the patient is so complex, how the patient is so systemic disorder.
That's perfect. Yeah, and these classes have just been a wonderful addition to our curriculum. It's how I practice, it's how our teachers practice, and it's just such a wonderful blend within all of our other techniques that we teach and within our thought process. So it's just been super complimentary, and we're honored to be able to bring your methods to the US.
Of course, it's our pleasure, and you know, hopeful to see you at Comic Con.